Birmingham is leading the fight against air pollution in the region and across the world. From medical interventions to the regulation of electric vehicles, our academics are improving the air around us. In the West Midlands, energy poverty is the worst in the UK. Air pollution affects 2.8 million people, reducing average life expectancy by up to 6 months. The region faces severe energy, business and social challenges.
The University of Birmingham has invested in Tyseley Energy Park. We are building an innovation hub that will provide businesses with the chance to develop their technology in collaboration with university staff. This hub will be a centre for training of state-of-the-art energy technology, waste and low-carbon transport systems.
The UK government presently plan by 2030 to ensure that at least 50% and maybe as many as 70% of all new car sales will be low-emission vehicles. That move away from petrol-diesel cars to electric cars will have significant benefits for the environment, both in terms of decarbonisation and also in terms of improvement of air quality. But we always have to be careful in technology transitions that we don't solve one problem and just create another. And therefore my research is part of a 9.5 million Industrial Strategies grant-funded project run out of Birmingham with the help of the Faraday Institution to prepare for the phasing out of hydrocarbon fuel and to handle this lithium-ion battery waste.
91% of the world's population lives in places where air quality exceeds World Health Organization limits, with 4.2 million deaths each year from outdoor air pollution. We are working to understand the causes of poor air quality and providing science advice to support clean air policy development, working in India, Africa, South America and Asia. In China, our work is measuring the concentrations and identifying the sources of urban air pollution and haze events in Beijing, finding out how people are most exposed and understanding how this affects their health, and ultimately determining what can be done about this.
Almost half of the world's population rely on solid biomass fuels such as wood, dung and crop residues for domestic cooking and heating. In East Africa, we're working with the University of Rwanda to identify the harmful health impacts of charcoal cooking and inform intervention measures to reduce the health risks. We have also successfully led a study on air quality in Nepal among those communities cooking indoors in traditional settings using solid fuels such as wood and dung. Our research found that levels vastly exceeded World Health Organization guidelines in these very enclosed, poorly ventilated settings using traditional wood fuel. The health risks identified include smoke inhalation, burns, eye damage, and a range of respiratory and cardiovascular health outcomes.
We are ensuring a brighter future. Birmingham inspires change towards better air.